I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about foods that you should be adding to your diet. Because normally when I do shows, sometimes it's doom and gloom, and I tell you what's going on with the chemicals and the foods and the steroids and the hormones and antibiotics. Today we're giving you all good news. These are foods I want you to start considering adding to your diet. And it's quick, it's easy, it's inexpensive, you feel great, you'll save money, no reason not to do it. I'm not just going to tell you how to add them, but why to add them. See, that's the thing. I've learned this after 35 years of dealing with patients, is that if I can tell you why and I can hit you with logic, you go, I really can't argue that point now, can I? You're right. And then you're willing to make some changes. So we covered a lot before. If you're just tuning in, go to my website, drjoe.com. This show will be on the website, drjoe.com. You can listen to that and over 1,000 hours of podcasts on just about every topic known to health and humanity in the world, I think. We have audios, we have videos. You can download them from SoundCloud if you want to listen to them while you're working out in your car. Really good way to educate yourself. Because people say, there's nothing on. Well, now there is. There's over 1,000 hours of really good stuff that you can learn to how to naturally get well and stay well. That's my goal. I want to get you well and keep you well. So, continuing on, cinnamon. You don't think about cinnamon. You think the only time I've had cinnamon was on a cross bun with some sugar glaze on it and a little bit of cinnamon on it. Well, yeah, that's one way to do it, but that's not a good way to do it. Cinnamon helps control your blood sugar. And this is why when I have diabetic patients and when I do shows on diabetic or postgraduate lectures on diabetes, I always say you got to add cinnamon to your diet. Because cinnamon stabilizes the blood sugar. And if you're type 2 diabetic, just 1 gram of cinnamon a day for about 6 weeks, that's only a quarter teaspoon every day. It's not a whole lot. Significantly reduces the blood sugar, and it also helps reduce triglycerides and low-density lipoprotein. So it lowers the bad cholesterol and fats in your blood. So wait a minute, a quarter teaspoon of something that's really cheap and really tastes good can stabilize my blood sugar, lower my triglycerides, lower my LDLs. Yes, that's how easy it is. There's a chemical in cinnamon that increases your cell's ability to metabolize sugar by up to 20%. Wow, and type 2 diabetes is insulin resistance. The cells are not able to utilize sugar because what happens is you eat a lot of sugar, the body releases insulin from your pancreas. So the insulin is released, it gets into the cells and it acts like a key, goes into the cell, opens it up and lets sugar in. That's how insulin works. So you're eating a lot of sugar, you're producing a lot of insulin, the cells can't take any more sugar in, doesn't want to get opened up, so the cell becomes insulin resistant. So now what happens is the cells aren't opening up, sugar builds up in your blood, and that's very dangerous. So with cinnamon, it allows the cells to open up and start utilizing the sugar more efficiently. So you only need about a quarter teaspoon a day. You don't have to get fancy extracts. You don't have to get just basic cinnamon. Try to get organic, of course, if you can. Quarter teaspoon a day. Had a patient come in just the other day. He said, Dr. Joe, I heard you talk about cinnamon on your show. I said, good. He said, I started adding cinnamon to Super Greens and Essential Source. I loved it. So I've tried it. It's amazing. So the Super Greens and Essential Source are the 2 supplements you should be taking every single day. It's the minimum amount of nutrients you need every single day. They're 2 powders. And I mix it with coconut milk or almond milk. But you add the cinnamon to it, it even makes it more effective. And the Essential Source has a nice flavor to it. It's sort of a little sweet. We use stevia. The Super Greens have a green flavor to them. And some people don't mind that. But if you want to add cinnamon to it, just amazing. So I really want you to get some cinnamon. Don't put it in your counter. Leave it out on the counter. This way you're going to see it every day. And when you mix up your Super Greens and Essential Source, add a quarter teaspoon or half teaspoon, as much as you want. And watch even better results. If that's possible, to get better results from Super Greens and Essential Source, because now you're helping stabilizing the blood sugar. And the cells utilize sugar more efficiently. So cinnamon is something I really want you to start adding to your diet. If you like it, of course. If you don't like it, that's okay too. And that's the thing too, is you don't have to do all these things we teach you. Years ago, I was talking to my IT guy at the time. And he said, you said something on your show I really liked. And I said, what's that? And he said, you said you don't have to do it all. He says, because I listen to you and I think, I got to do this all. No, you don't have to do it all. Do something. Say something. Do something. Any step is going to be better than what you're doing right now, as long as it's a positive step. So at least take the Super Greens, the essential source. Start adding things. Try Swiss chard, try beets, try adding cinnamon to things. Little steps are going to go, oh, now I see what he's talking about. I can have that kind of energy. My brain can work like that. I can feel that good. Yes, you can. There's no secret. I don't have some secret that I have hidden away. I'm not going to tell you what it is. I get chiropractic care on a regular basis to keep my nervous system strong. I make sure my digestive system is working properly. And the supplements I take are Super Greens Essential Source. I take probiotics to keep my colon strong, and talk about that in a second. I take adrenal support, because as I'm getting older, my adrenal glands are getting weaker. Omega-3 fatty acids, you probably want to add to your diet as well. So it's not hard. It's easy. And if you come to our office, or even if you're listening around the world, we can put together a protocol specifically for you. And if that's what you like, we can do that for you. What supplements would I recommend? What dietary changes would I recommend? It's not hard. It's easy. If you go to my website, drjoe.com, if you got to start with some video, watch the 7 Deadly Sins of Nutrition. I made it a couple years ago out in California. And that's the basics. And then there's an audio companion called So What Can I Eat? So the 7 Deadly Sins of Nutrition, So What Can I Eat? Listen to those two. That's going to be a good starting point. But there's over 1,000 hours of other shows on the website as well, too. All right, continue on. A lot to cover, very little time. Other foods I want you to start adding to your diet. Pomegranates. Now, if you know what a pomegranate is, it's red. And when you cut it open, it has a bunch of little tiny red seeds in it. And so it's kind of a little tricky to cut open and peel and get all these seeds out. There's ways to do it. Go on the internet and watch this. A lot of ways they can show you how to do it. But the pomegranate is loaded with nutrients and antioxidants. There's a study in Israel. If you took 2 ounces of pomegranate juice for a year, it decreased your systolic blood pressure by 21% and improved the blood flow to your heart because it's loaded with antioxidants. Now, I like that idea. However, I'd rather you eat the whole pomegranate and not the juice. And the reason is when you eat any type of fruit juice, you're concentrating the fructose. And when fructose gets into your liver, it converts into uric acid, which gets in your joints, and it hurts. And I'm a chiropractor. My team of doctors are chiropractors. We want to get you well. We want to get you away from pain and things that cause pain, not toward them. So eating the whole pomegranate is going to give you fiber to push the sugar through the colon. All the benefits, none of the downside. It's pretty cool. And too much fructose creates uric acid. Uric acid prevents the body from producing nitric oxide properly. Nitric oxide increases circulation. We talked about that earlier in the show. It's one of the supplements I really enjoy taking called Dr. Joe's Nitric Oxide Support because it opens up your blood vessels, helps your brain work, helps your body heal. Really important to get enough nitric oxide in our body. And as we get older, we produce less and less nitric oxide. So why not take a supplement to keep the body young? I'm going to fight this aging thing, man. I want you to, too. And when I say aging, it starts the minute you're born. So start doing the things you can to keep yourself healthy. You'll be very, very happy with those choices. Goji berries, they came on the scene a while ago. And I was talking about this on a show I was doing the other day. Every now and then it's the end-all, be-all. Start taking this and it's going to be great. Maca powder is one of them. Oh, you take maca, it's going to change the world. And then goji berries came along and it's like the end-all, be-all, greatest thing in the world. They're all good. It's part of a complete protocol. So goji berries are great. It's kind of crossed between a cranberry and a cherry. If you've never had them, the little tiny red, kind of red pinky things. They've been used, we have access going back to 1700 years. Goji berries have been used as medicine. This is back in the Tibet research. Goji berries have one of the highest ORAC values. That ORAC value tells you how much antioxidants there is in there. So it's loaded with antioxidants. Kind of new to America, the goji berries. They weren't around 20, 30 years ago, and now they're kind of making this big uprising that they should be part of your diet, and they should be. I agree 100%. They can reduce insulin resistance, which is kind of cool. We talked about that earlier with diabetes. They're just little berries. Eat them fresh, put them on cereal if you want to, put them in oatmeal if you'd like. They're really good, the dried ones. I mean, you can eat them fresh or dried, actually. But just pop them in as a snack. But once again, in moderation, because they do have sugar in them. We've got to keep those sugar content low if we can as you go through your life. Prunes are another one that kind of faded out of existence. They're popular with old folks again because they help the bowels work very well, and they do. They work extremely well. But they're very nutritious as well. Now, what are prunes? They're dried plums. So you could just eat plums as well. And again, the darker the color, the higher the nutrient value in most cases, and plums are usually a very dark color. Here's the thing with plums. There's different types. But when I was young, growing up in Hoboken, walk down memory lane here, we used to have a guy called the peddler come around. And he would have a truck, and on the back of the truck, there was like an inclined board, I guess, big board. And he'd have little slats on it, and he'd have cartons of groceries up there, cartons of fruits and vegetables. And he'd park in the corner and he'd yell, "Hey, peddler!" And you'd all come out, and you'd buy your fresh fruits and vegetables right off the peddler. And he'd have a little scale there, and he'd throw some things there, you weigh it, kind of guesstimate, you give him a couple of bucks, whatever it was, you go. And the food was spectacular. The plums were rich, and they were juicy, and they were sweet. And the peaches were spectacular, and the greens were so green and vibrant. And now, with mass production, a lot of that's been lost. And it's sad, because if I go to Europe, they have food like that. And it's one of the reasons why people love going to Europe, like Italy. You have those rich volcanic soil foods growing, and it tastes like the old days, tomatoes, and big and juicy. So if you're going to do things, and you're starting to find, if you're old, that they're not as juicy and tasty as they used to be, go organic. Because organic has a lot of the nutrients in the soil that were there 30, 40 years ago. Now they're being depleted. So I really want you to consider organic whenever you can, especially if you're going to eat the skin. So if you're going to eat plum, you're going to eat the skin, you want to make sure it's organic. So loaded with antioxidants, very good for you. Prunes you can eat plain or stewed. Try to do organic again so you don't get the pesticides in there. Be careful, because they do stimulate the bowels. And so if constipation is an issue, you might want to consider prunes. But if it's not, just don't eat a whole bunch of them. You're probably not going to be happy with the results, and people around you aren't going to be happy either. I want to talk about seeds for a second, like pumpkin seeds. Seeds are great. You got to realize seeds are they have everything in there to grow life. You can plant a seed and a tree grows out of it, or a plant grows out of it, or a pumpkin grows out of it. So seeds are a super high concentration of nutrients that are in a capsule, so to speak, so that you can grow life out of it and has all the nutrients it needs to sprout. So pumpkin seeds are great. Once again, try to do organic. You can eat the whole shell if you want to. You can break them open and get the seeds out, but you can actually eat the whole shell. Now, I don't like doing that because it's very chewy, and sometimes they get caught in your teeth. My uncle, Uncle Skater, all my father's brothers had nicknames, all S names. We have no idea why. It was Shaky, Sinatra, Skater, Sharky, Sally. So he had 8 brothers. So he would eat the whole sunflower seed as well. And I always thought that was pretty weird. Again, not that bad. Again, if you don't chew the shells very well, though, as they go through your colon, they could create little tears in your colon, and that could be a problem. But pumpkin seeds are loaded with magnesium. If you listen to my shows in the past, magnesium is really important because magnesium helps relax your blood vessels. It helps relax your bowels. If you take magnesium, milk of magnesia, it kind of relaxes everything, gets everything moving. So, but magnesium is one of those nutrients most people are deficient in. So you want to start adding more nuts and seeds to your diet, you're going to get a good source of magnesium. Pumpkin seeds being a good source. Relatively inexpensive. If you like them, great. If you don't like them, that's okay. Switch on to something else. So let's talk about some other things I want you to have in your food pantry. Sprouted seeds, as we're talking about seeds, sprouted seeds might be something you want to consider as well. So sprouts are great because, again, the seed has all the nutrients in it. When it sprouts, the nutrients are there. Now, you can make your own sprouts if you want to get real natural and organic there. Making sprouts is so easy. You can take chia seeds, pumpkin seeds, sunflower seeds. You can buy a sprouter. It's a real simple thing. I have one. It's layers like a shelf, and you can pour water on it just to keep it moist. You can take a pantyhose and put it over a jar and put water in it, shake it out, and drain it out. Or you can just buy sprouts. They're really inexpensive. They're usually grown locally because they don't last very long. But start adding sprouts to your diet. Excuse me. I think you're going to be amazed at what happens with the sprouts. Try to get them fresh. If they start to go bad, don't eat them because they can grow bacteria and viruses and whatever else grows in there. But really start thinking about sprouts. They really are something that's just loaded with nutrition. About 30 times more nutritious than the seed itself. Once it sprouts, the nutrient level skyrockets. Because again, I want you to make good decisions in your life. Because I want to be your doctor. My team of doctors, we want to be your doctors. So whether you're actually a patient of ours or if you're just a listener, if you read our books, you go to our website, we want to help get you well and keep you well. So we want to get your diet right. And these are things you can do yourself. You want to get the right supplements, Super Greens, Essential Source, minimum amount of nutrients, vitamin D, especially in the winter. If you get your vitamin D checked, whenever you get your blood work done, just make sure the doctor's checking your vitamin D. Most people are deficient in vitamin D, especially dark-skinned people. So you want to get about 5,000 international units of vitamin D a day. That's on my website, drjoe.com. You can get Dr. Joe's vitamin D. The Super Greens, the Essential Source, the nitric oxide. We have B-complex. Most of us are deficient in B-complex. Adrenal support, I take that every day. So if you want to get the supplements, go to the website, drjoe.com, or stop in one of our offices, save the shipping. You can go to Marietta, Duluth, or Stockbridge. Going to save a ton of money on, not a ton of money, but you'll save money on shipping, and you get to say hi to us. If you want to make an appointment to come see us, if you have neck pain, back pain, shoulder pain, achiness, fatigue, fibromyalgia, I mean, I can go on and on and on. Come see us. Stop suffering needlessly. The biggest complaint we get is, why didn't I do this sooner? Why did I suffer for so long? So if you're serious about wanting to get well, if you're sick and tired of being sick and tired, go to the website, drjoe.com. We have offices in Marietta, Duluth, and Stockbridge. You can make an appointment right online, or you can call us. We want to be your doctors. We accept most insurances, car accident, sports injuries, Medicare. If the car was damaged and you were in an accident, you were damaged. A little bit of damage or a lot of damage to the car, chances are, I'd say 100% that you were hurt. So come see us and check it and get it fixed before it becomes a serious issue. Every day, patients come in with problems that they got when they were a teenager, when they were 10 years old, they fell off a horse, they played football, and now they're 30, 40, 50, 60, 70, and regretting that they didn't come see us sooner. So stop suffering, drjoe.com. So we're talking today about foods I want you to add to your diet. Fermented vegetables, I brushed on that in the first part of the show, are something you might want to consider as well. And most cultures have cultured vegetables. How about that? But most people in America don't eat the cultured vegetables. Like the Germans have sauerkraut. Now here's the thing. If you buy sauerkraut in a can or if it's in a jar, if it's pasteurized, it probably killed off a lot of the good bacteria. Same thing with kimchi, which is Korean. It's cabbage as well, different type of cabbage. But if it's been pasteurized, it kills off a lot of bacteria. So you want to try to get it fresh, or if you're really adventurous, you can make it yourself. Really easy to make. I mean, think about this. A lot of these poor countries, they don't have modern technology. They don't have refrigerators. They don't have a lot of things, especially years ago. So they had to make their food and preserve it. And that's one of the reasons that they went through this fermentation process. So you can make your own cabbage if you want to, your own sauerkraut or kimchi. But your colon has about 100 trillion bacteria in it. And we talked earlier, if you're taking antibiotics, you're killing off those bacteria. How do we replace those bacteria? By taking probiotics. Probiotic. Biotic means life. Pro means in favor of. You're in favor of life. Antibiotics, break it down, against life. It's killing the biome or the bacteria in your colon and your whole body. Now, I'm not saying don't take antibiotics. Sometimes you need them. Absolutely. It's a wonder of medicine. However, if you do take them, it's really important to recolonate your colon. Just about every day, I get an email or a phone call, or a patient comes in and they have thrush, they have vaginal infections, they have itchy rectum, they have armpit rashes, they have a white tongue, and it usually follows a round of antibiotics. We know that. That's not a secret. And so you got to get those probiotics back into the body, and you got to stop putting other antibiotics in. It's a bit of a challenge to not wipe out thrush infections or yeast infections, but you need to do it. I don't think there's any other choice. So you can make your own fermented veggies. You can buy fermented veggies. Again, they're probably pasteurized. One of the products on our website, drjoe.com, is Dr. Joe's Probiotics. And the reason I have that there is because so many people, all of us, are being exposed to antibiotic agents every single day. So probiotics is something you probably want to add to your diet, and also your children's diet as well. As long as they're eating solid food, you can add probiotics to them. And it's vital. And with doing studies now, I get this all the time. Dr. Joe, I've done everything I can to lose weight, and I'm not losing weight. How many people have had that done? Raise your hands. I exercise all the time. I can't lose weight. Raise your hands. Well, some of it could be genetics. Some of it could be you lying to me, which is what I usually find. Well, I'm dieting every day except Tuesdays, Thursdays, Fridays, and then, of course, Saturdays I can. And then Sunday nights is always, we have chicken wings. And so you really got to get serious. And the older you get, the harder it is. But we're finding that different people have different types of bacteria in their colon. Fat people have different bacteria than skinny people. And this is a thing. It's a little weird. It's called a fecal transplant. They're taking fecal matter from skinny people and putting it in fat people, trying to recolonate their colon with this skinny bacteria. So my thought process is, what if we just eat things like cabbage that are high in probiotics, or sauerkraut, or kimchi, or Dr. Joe's probiotics, and try to get the good bacteria into our colon ourselves without having to go through the extreme process of a fecal transplant. I think that's kind of a little silly, actually. But probiotics, so important. Even in Dr. Joe's Essential Source, we have prebiotics and probiotics. Prebiotics feed the bacteria that are in your colon. Probiotics are the bacteria that's in your colon. So there's no reason why with all the knowledge that you now have after listening to my shows, you shouldn't be taking all these positive steps. And if it's the first time you're listening, go to my website, drjoe.com, well over 1,000 hours of podcasts, audio and video. And by the way, if you have questions, send them to me through the website. I'm more than happy to answer your questions for you. I want to help you get well and stay well. Avocado is another thing you might want to consider adding to your diet. They're loaded with monounsaturated fats. That's good for you. High in potassium. Potassium is important because most of us get lots of sodium, but we don't get enough potassium. And so the avocado can help balance out that sodium-potassium ratio. Why is that important? You may have heard that. Balance out your sodium-potassium ratio. Because in your nerve cell, you have sodium and potassium on the inside and the outside of the cell. And when they switch back and forth, they go in and out of the cell, they create an electrical impulse. And that's how your nerves work. How do you think we generate electricity? We're not plugged into the wall. We're not a battery. So the sodium and potassium switch back and forth in and out of the cells, creating this electrical charge or electrical field that is an electrical impulse. And so if you have too much sodium and not enough potassium, it could actually affect the function of your nerves. Now, as a chiropractor, you hear me talk about pinched nerves all the time. And a pinched nerve can hurt. 90% of the nerves don't feel pain. So you can have a pinched nerve and not know it. But we also have to make sure the nerves themselves are healthy. And that's why you want to make sure you have a good balance between sodium and potassium. That's why I recommend Himalayan sea salt or air-dried sea salt. It has over 70 different nutrients in it. So you want to add that to your diet to get those nerves working properly, as well as everything else working. Macadamia nuts. Macadamia nuts. I was in Hawaii one time doing a seminar, and a lot of companies hire me, and I go out and do workshops. So if you have a company you want me to come speak to, let me know. But I was in Hawaii, and we go to the tour of the macadamia nut plant, and they said, macadamia nuts have omega-3 fatty acids in them. And I said, I did not know that. So I love macadamia nuts. If you've never had them, they're one of my favorites. They're very expensive, but they're great. And they're loaded with nutrients and vitamins and minerals and good fats, because you need fat in your diet. You just need good fats. So macadamia nuts, pecans are great as well. Walnuts are great. Not a fan of peanuts. Peanuts have a mycotoxin, which is a fungus that grows in the peanut, except for Valencia. Why Valencia don't grow this fungus, I don't know. But the mycotoxin in peanuts can cause allergic reactions and affect the immune system. So I strongly advise you don't eat peanuts. If you're going to eat peanuts, make sure it's Valencia only and make sure it's organic, okay? I don't eat peanuts, so I don't even know where to get them. Don't ask me, I don't know. Organic coconut oil. Organic coconut oil has something in it called lauric acid. And lauric acid converts into monolaurin, and that's a monoglyceride that can destroy fat-coated viruses, such as HIV, herpes, influenza, measles, gram-negative bacteria, protozoa, giardia. So what happens is these viruses are smart. These viruses, they create a biofilm, it's called. And your immune system doesn't recognize this it recognizes the biofilm as being friendly. So the immune system's floating along and it sees this virus with this coating on it. It's kind of like a camouflage. And the immune system goes, that's okay. And it goes right past it. The monolaurin from lauric acid can get in there and break down that biofilm. And then the immune system can spot these viruses and attack them. So coconut oil is something you might want to consider adding to your diet, or coconuts, of course. It also has been shown to help with things like Alzheimer's disease. It has medium-chain triglycerides, which are easily used as fuel. And if the brain isn't utilizing sugar properly, that's one of the things. I did a show, I think it was last week, on Alzheimer's. You can go to my website, drjoe.com, and listen to that show. Really good show, by the way. And we talked about how the medium-chain triglycerides can be used as fuel for the brain. If the brain isn't using glucose, it can use medium-chain triglycerides and can help the brain reboot itself, for lack of a better word. So coconut oil is something you might want to consider adding to your diet, but here's the rules on coconut oil. It has to be organic, and it has to be unfiltered. Very important to get that. Got to touch on garlic. We're running out of time here. As an Italian, you have to have garlic. Garlic is antibiotic, antiviral, and antifungal. It boosts your body's natural abilities to protect against hypertension, osteoporosis. It can decrease your risk of various forms of cancer. Absolutely important. There's one of the products I have on my website. I don't talk about it much. It's called Dr. Joe's Seasonal Tonic. And whenever I feel a cold coming on or I feel a little virus kicking in, it's ginger, horseradish, cayenne pepper, onion, garlic, pureed in apple cider vinegar. Tastes the way it sounds. And I take about 2 or 3 dropperfuls every half hour. I know it says take it once a day. I take it every half hour. I may intersperse that with Dr. Joe's Wellness Booster, which has herbs in it to stimulate my immune system. Can't remember the last time I was sick. It's been years. So if I do feel my body getting a little weak, Wellness Booster and then Seasonal Tonic. And those are just amazing. Those are on the website, drjoe.com. And of course, I take vitamin D every day to keep my immune system strong, along with Super Greens and Essential Source and nitric oxide and adrenal support. So if you want to get the supplements, go to my website, drjoe.com. If you want me to put together a personal plan, you can call the office. We'll set up a time. We can do a nutritional consult with you. If you want to come see us, which is absolutely positively the best thing you can do, go to my website, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We accept most insurances, car accidents, sports injuries, Medicare. We want to be your doctor. And if you have an injury, if the car was damaged, you were damaged. If you have pain, there's something wrong. Don't ignore it. The biggest complaint is when people say, why didn't I do this sooner? The website is there, all the information you need, over 1,000 hours of video and audio podcasts. We want to get you well and keep you well. Folks, I'm Dr. Joe Esposito. The website, drjoe.com. We'll catch you next time. Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.